Well, February is American Heart Month, a time to focus on cardiovascular health. Heart disease is the nation's #1 killer, and it's never too late to make some simple changes that can save your life. Dr. Roy Flood is an interventional cardiologist at St. Joseph's Hospital and SouthCoast Health. He joins us now with some advice and some common questions you may have. Good morning, Dr. Flood.
Good morning. Thank you for having me.
Yeah, thanks for being here. So, February is a month we really think about our heart health. Should be doing this all year round, but I guess, kind of just tell us, what are some of these statistics that people may not realize about heart disease and how serious it is?
Well, I think you hit upon the first one already. Heart disease is by far the #1 killer in the U.S. It affects both men and women and actually kills more women. It is a fast-growing field. There are many different signs and symptoms of heart disease that I'd like to talk about if we have a few minutes here. Especially in the time of COVID-19, we're seeing more problems with people coming in later. They're presenting later to the emergency rooms, to our offices, with signs and symptoms of heart disease. And it's been a huge problem now and since 2020, since the pandemic started.
So it is something that if you recognize and if you seek medical treatment for, you can get help. So what are some of the symptoms that may kind of be forgotten about or overlooked?
Fatigue. Fatigue is a big problem, more so in women than men. But if you have new onset of fatigue with exertion, this is something that we need to think about. Nausea and vomiting. People commonly think about chest pain and arm pain, shoulder pain, etc. But if you're having unexplained nausea and vomiting and you have risk factors, you're a smoker, you're a diabetic, perhaps you should think about heart problems.
What are some things that you really need to call 911 for? I mean, you mentioned pain, but what is a situation that you could be in where you need to go to the ER or get an ambulance immediately?
Chest pressure, chest tightness, severe difficulty with breathing. Those are all signs that something bad may be imminent and help is needed right away.
Yeah. So you mentioned COVID-19. How is COVID impacting our cardiovascular system? I mean, what are you seeing now that we're entering our 3rd year of this pandemic?
Well, I think I mentioned the late presentation. But from a cellular scientific level, COVID actually increases the risk of clot formation in the arteries and veins of the body.
Wow.
And clot formation is the basis of problems with the heart and mainly with heart attacks. So we're seeing heart attack patients that come to the hospital later, and often this is compounded by the fact that they've had COVID or they currently have COVID, and their disease is much more advanced and they are in a much more dire strait by the time they present to us.
And I mean, COVID just overall, it puts more strain on your body, on your organs, right?
Correct. It is a very difficult disease to handle in terms of both lung disease and heart disease. And if you have the combination of the two, that makes the job that much more difficult.
Absolutely. So a question I have for you, if we can come back to us on camera here right now, what is the worst thing that you can do for your heart?
Well, I think the worst thing one can do is smoke. I think the second most dangerous thing is to not be aware of your own personal risks. If you have a family history, if you are diabetic, if you are hypertensive, if you have hyperlipidemia, high cholesterol, if you don't know those things, you're a walking time bomb. So if you can be aware of your own personal health issues and don't exacerbate things by smoking, you're ahead of the game in terms of staying safe from a heart standpoint.
And I feel like all those things you just mentioned are why regular checkups are so important. But I've heard from doctors that in this kind of COVID era, a lot of people are delaying those regular checkups and putting them off.
And we're seeing that firsthand. People are very leery of going to routine doctor's appointments, and they are definitely very hesitant to present to the hospital in the case of emergencies. And even though the idea is they will be safe by not being in the mix of other sick people, what really is happening is by the time they are attended to, their problems are much worse than they could have been with an earlier presentation.
Yeah, so all it takes is that, conversation with your doctor and really just educating yourself.
Correct.
Thank you so much for joining us. Lots of good information. We appreciate it.
It's a pleasure. Thank you.